Oh, there are so many devices that track our heart rate during a workout or even a walk.
Here to break down whether or not those readouts are worth tracking is our medical expert, Dr. Payal Kohli. Dr. Kohli, good to see you. Let's talk about, for starters, heart rates. I get that when I work out, and I know I should be in this heart rate, but to a lot of people who don't track that stuff, what does it mean?
Yeah, as a cardiologist, I tell all my patients to track their heart rates during their workouts because tracking your heart rate tells you a lot about how your body's responding. It also tells you how good you're meeting the goals of your workout. So instead of just looking at that number, Phil, what I want you to do is take the number 220, subtract your age. So do this math in your head.
Okay.
Okay, multiply that times 50%, that's what your warm-up heart rate should be. So 50 to 60% of that 220 minus your age is your warm-up zone, zone 1, where you're just kind of getting your muscles ready and getting the blood flowing. Zone 2 is when you're starting to burn fat, and so you can see that there. Zone 3 is where I want most people to live, moderate intensity, 70 to 80% of their maximum predicted, which is that 220 minus age. And then zone 4 to 5 is where you're really high intensity. That's where we see the athletes. That's where you're building power. So looking at that after workout tells you how your body's responded. It also tells you how you're doing over time with trends.
I'm so glad that we're talking about this. As someone that used to track her heart rate like crazy when I used to swim at UCLA.
Oh, really? Yeah.
Oh, remember we talked about this?
Yeah.
Like crazy.
Yeah.
Now, what I go after, like if I'm just like, doing a run or a walk, am I trying to meet the same, like if I was doing like 140, 160, 160, 180, am I trying to meet the same heart rates that I used to try to chase back then?
As your 18 or 19-year-old
That's
self?
exactly what I was going to say. So first of all, your
for
age
you if
is
you
different,
can.
Sam. So that target keeps shifting because your age keeps shifting.
So what
you
should
have
it be
to
now?
Calculate, well, I don't want to say your age on television.
Take my age.
Okay,
so if I'm 45.
So 220 minus 45.
Yep, 175.
Okay. Yep.
Okay.
And then you multiply that. I want you to be in the 60 to 70% of that for maximum cardiovascular health. Now you're very thin, but if you were trying to lose weight, you actually want to dial back a little bit, be more closer to 60%. If you're trying to build endurance, you want to be around 75%.
Interesting.
But you're not an athlete, so you're not getting into zone 4 or zone 5, which is where you would be when you were swimming at UCLA.
That is fascinating. I'm glad you said that because I've been chasing those numbers and they're hard to catch.
It will get harder as you get older.
Will you call me very thin for a second? And when you're done with that, thank you for the compliment in advance. What about recovery from these zones?
Yes, I love this metric, and it's people don't appreciate it. In fact, I haven't calculated my own, but it's a great metric because it tells me how quickly does your fight or flight response, which is activated during exercise, switch to rest and relaxation. And the key number to remember here is 12 beats in a minute. Okay, so the way you can calculate it, quick and dirty, I want both of you guys to do this in the break.
Okay.
Jog in place really fast.
During the break, okay.
Get your heart rate up, and then measure your heart rate. And then a minute later measure it. And it has to drop by at least 12 points. That's your heart rate recovery, that's normal. If you drop by 20 or 30, then you're an athlete, you're actually very fit. If you don't drop and you're blunted, it puts a target sign on you that your nervous system is really amped up and we need to do something about it.
That's a great metric. It also could give you a heads up that maybe there's something off about your heart and you should see someone like you.
That's exactly right. You would need a cardiologist, and it doesn't just predict risk today, it predicts risk in the future as well if your heart rate recovery response is
I didn't realize flight or fight was triggered when you
I didn't
exercise.
Yeah, it's an activation of your sympathetic nervous system. So your blood pressure goes up, your heart rate goes up. It's a way to sort of tune that fight or flight response, but make it come on and come off on a dime. Now, the other thing that's nice is something called heart rate variability. This is a harder one to track. So let's say your heart rate is at 65 beats a minute. Every interval between heartbeats is not exactly the same. So for this, you'll need like a smartwatch or an Oura ring or something else that tracks the heart rate variability, and it varies from day to day. So that tells me about your nervous system, your stress, your sleep, because if you have a high heart rate variability, that's great. If you're blunted, not as much so. So how do we end up using it? If it's a day you didn't get much sleep, the heart rate variability is down, I say skip the exercise that day because you're not ready.
I like that.
Great.
Okay.
Dr.
Thank you,
Kohli, thank you so much.